Hi, friends. It's Natalie, and welcome back to the podcast. I'm really glad you're here today because in this episode, I'm sitting down with Dr. Karyn Shanks to talk about what it really means to take charge of your health, especially when you're dealing with chronic illness or confusing symptoms. We're going to dig into why seeing ourselves as many parts, many problems can keep us stuck, and how new science like epigenetics and functional medicine can help us rewrite the old stories that we are telling ourselves. Dr. Karyn shares her personal journey, the holistic tools we all have available, and some practical steps you can use right now to tap into hope and resilience, even if you feel held back by an illness or a diagnosis. She opens up about her book, Unbroken, Reclaim Your Wholeness, and gives us some tips for being present, taking control, and finding healing that goes way beyond medicines or prescriptions. So if you're tired of being put in a box, this episode is a gentle nudge to you to look deeper, ask some new questions, and start feeling empowered about your health today. Before we dive in, I want to remind you, make sure you hit the subscribe button. I have so many great episodes still to come this year and into next year. And sign up for my weekly newsletter. I've been working really hard to bring you great information that will help your health and your mental health. It's a newsletter that you get in your inbox every week. You can find it at natalietysdal.com. I want you to always be in the loop with the new episodes and the resources that I have for you and all the best wellness advice out there. So, with no further ado, let's get started today with Dr. Karyn Shanks. Dr. Shanks, thank you for taking the time today.
Thank you. Thanks for having me.
You bet. So, I'm fascinated by your story because I think it's in some ways similar to mine in leaving an industry that I was frustrated with for helping people. And I know as a doctor, in a very different way, that's what happened to you.
Absolutely. I understood that from day one, my first practice, fresh graduate of residency in internal medicine, top-notch training in Western biomedicine. And I realized I don't know a thing to help these people. I know how to take care of really, people with catastrophic illness who are laying in a hospital bed, but I don't know how to help people, with what they really want and what they really need when they come to see me, in a clinic. And so I started shifting my practice from day one towards something that, could see people more as whole people, that could understand their suffering and their concerns in the context of their whole lives. And I have to say, they really helped me guide me on what those shifts needed to be by telling me what they needed. And so that began this whole journey of studying functional medicine, integrative and holistic medicine, and kind of evolving into my own practice style to better fit the needs of the people who came to see me.
Well, those who have listened to this podcast for a long time know that I like incorporating both. And so that's very similar to where you are, where I talk to doctors, I talk to functional doctors, I talk to nurses, talk to psychiatrists and psychologists. And so
Yes.
understanding all of that
Yeah,
gets us to a better place.
absolutely. 100%. Yeah.
So let's talk about chronic illnesses. That's really the focus of where I want to be today because so many people get a diagnosis and they think they are just going to have to live with that for the rest of their life. And it can be a variety of things. How do you help people like that? Because you've told me and I've read on your journey that that's really what got you into this as well.
Yeah, I think we're taught that when we're sick or suffering or have pain, that we have this problem, this disease, and it's a thing that's fixed and it's a thing that can be described. And then there's a very specific protocol for how to manage that problem. And the problem with that disease-focused model is that it really doesn't capture all of it. It puts us into a box that
Mhm.
doesn't capture all of what's going on with us. And so it's very limiting. Um, And then when we believe it, as the consumer of healthcare, we believe that model. We think we've got this thing that we're always going to have, that we have no way to break out of, that we're completely dependent on these experts in these areas to fix us. And
Yeah.
it completely limits what we can do, what our possibilities are. In
Yeah. And
functional medicine, we in some ways set that diagnosis aside. Okay, what's truly going on with this person?
yeah.
We
Yeah.
collect this extensive amount of data and put it into more of a story of illness, a story of this human being that is suffering. And it's so much more nuanced and so
Yeah.
much more, there's so many more avenues where we can take off um, and support people and move them in a direction of healing.
Well, in some ways, that's how medicine has developed, where you have a diagnosis, now you just take this pill the rest of your life,
That's right.
versus you have it, let's see what we can do to manage it, and let's see what we can do to get the rest of your health to a place where it's really not that big of a deal in some cases, versus just take the medicine forever.
That's right. That's right.
Yeah.
And we're looked at as I I always used to say about myself, because I have a condition called Ehlers-Danlos syndrome. It took me decades to realize. I just thought I was this person who just kept getting injured, tendons, ligaments, joints, um, and the injuries seemed to come out of the blue. And I was always in pain. And every time I went for help, I'd go see my sports medicine doc or a physical therapist. It's like, okay, we're going to treat this problem. And so I became what I kind of joke about, but not really joking. I became many parts, many problems. That's who I was as a patient. I was many parts, many problems. What was going on? And it wasn't till I had a major episode with a tendon in my shoulder, a tear, and I had to have surgery. And after surgery, I just collapsed, and I went through this period of profound fatigue and body wide pain, not just in my shoulder, but my back, my hips, and one day I checked my blood pressure just on a whim. I was like in despair, like, oh my God, my life has just collapsed underneath me. And I took my blood pressure and it was like insanely low. At
Mm.
sitting, it was 80 over 50. And then I stood up
Oh
and
my
it was
gosh.
70 over 30, which for those of you who don't know about blood pressure, that's really, really low.
Yeah.
And I'm like, oh, but for me, it was like a eureka moment. Like, oh, okay. I get the fatigue. I get the fatigue that was also part of my many parts, many problems journey over decades. And I realized, oh my gosh, I think I have a connective tissue issue. And as I looked into it and I worked with some folks and I was tested for Ehlers-Danlos syndrome, that's exactly what it was. And once I realized that, I then had an approach. I knew how to manage low blood pressure. I knew how to manage these more vulnerable aspects of my anatomy. And in putting all that into practice, I function at a really high level where I know a lot of folks with the hypermobility and low blood pressure aspects of Ehlers-Danlos don't do so well.
So you were able to, it changed your frame of mind around
It did.
chronic things, and it was that kind
Yes.
of the beginning then of your journey and in functional medicine?
And I'd already been in it, but I didn't apply it to myself, which is
Mm.
like
It's
uh,
always what happens, right?
always what happens. And then once I did, like, oh my gosh, and I have, you know, I have I have all this potential that is just wrapped up in me that I can direct. I'm not a victim of this disorder. I know what to
Mm.
do. I know I have to go to the gym and stay strong. I know I have to have some people on my team, a good physical therapist who can address issues that arise. I know there's certain things I have to do every day to keep my blood pressure up. Um, but I can do that.
Mm.
I can thrive even though I have this potential vulnerability. It doesn't have to be a disaster.
So that and others, give me some examples of how functional medicine and what you do and what tips you have for someone who maybe has just gotten a diagnosis that they think is just going to plague them for the rest of their lives.
Right. And the advice I would give to people really depends on what the chronic illness is, obviously, and who they are, how they define their needs and what their goals are. So I don't want to hold up a goal that is mine. I want to make
Mm,
sure it's theirs. So they're in the driver's seat. They're steering their own ship. I think that's really important. But what I tell them about, a chronic illness is a label. It's a construct. The experience of the chronic illness is very real, and we just need to look at it in a different way. We're going to look at all the things. We're going to look at every part of you because it's all connected.
yeah.
Your physical body and what your genetics might predispose you to, they don't determine a great deal of what goes on with us because our gene expression changes depending on what environment they're in. And that environment, there's a lot of aspects of that we could change. So I let them know how much potential there is built right inside them that we know that there is a robust scientific basis for, right? And we're going to look at them very, very broadly, every aspect of their lifestyle, every aspect of what's happened to them before. So we can not only understand their story, but begin to identify what their needs are. And I'm talking about, somebody may have, say, arthritis, right? Or they've got knee pain, or, they have something that at least seems to be affecting a certain part of their anatomy or a certain organ system, but everything's connected. So we're going to look at all the things, including what's going on in your life. What are your stresses? What kinds of traumatic events have you experienced?
How do those things, if I can just, sorry to interrupt you, but I think it's important that we talk about that. How do those things, the events that have happened in your life, really affect the physical part of a diagnosis you have?
Because first of all, you cannot separate the physical from the emotional, from the spiritual, we cannot separate those things.
We try to.
We sure do try. And we've been very successful at it in that everybody believes that that is true. Even if they think they believe that we're mind, body, spirit, we operate in a very different way. And conventional Western medicine operates very much on that model, that
Mhm.
the body is separate from everything else. And it's a machine that breaks. It needs to be fixed.
It breaks and you put a piece of tape on it or give it some medicine and now it's all better.
That's right. Yeah. So that all of that is connected. So traumatic events drive changes in our physiology and the way our nervous system is activated,
Mm,
all to keep us safe. Our body its number one priority is to keep us in safety. And so that is a whole mind, body, physical activation. So absolutely, trauma is connected to what makes us sick, especially the things we know most about because it's been studied are like autoimmune disorders,
mm,
heart disease, uh, cancers, just a whole host of very,
mm.
very common chronic complex problems. Absolutely have a connection to childhood trauma.
So addressing those things with a mental health expert, admitting that they've happened, like, so what I'm hearing you say is that you get that help in all parts of your life.
Yeah, absolutely. We want to support everything. And it might not be just between me and the client. Yeah, they may need a mental health person to work with them so that, they can really dive into
Mm,
what that past trauma is. And
yeah,
a lot of times it's not like some big, what most of us think of as traumatic events are really bad things that happen. But more often than not, it's the things that didn't happen that should have. You know, we didn't quite get the attention or the love or the, support or whatever as a child, which is so, we've all had that. It's really commonplace. But as a small child, that's taken in as messages about ourselves, like, well, I'm not enough, or, whatever it is. And that has an impact on what happens down the road.
yeah, yeah. I want to go back to something that you mentioned because I'm fascinated by this right now and I'm learning about it, but it's epigenetics.
Yeah.
And you mentioned it briefly. How, and more people are getting these tests from just the ancestry part of it. And I know there are some more in depth tests. I've just recently done one, as a matter of fact.
Hmm.
What do our genes really spell out for us? What can we and should we be doing by learning and getting this type of knowledge of what genes we have, we don't have, or the mutations of genes?
Yeah. Well, I think this is an emerging field in terms of being able to actually apply it in a very specific way to daily life and clinical practice.
Yeah.
So I think it's premature to say that we can do a genetic profile and we know exactly what to do about everything we find.
But how does it helping now with the little bit that we do have? How are you applying it?
I First of all, I'm applying it as a global concept, irrespective of what we know about your exact genetic profile, what your DNA is actually saying. Like you have the gene for this, you've got a unique variation of this gene that can predispose you to X, Y, or Z. We can do that, and I look at some of those genes
Mm.
because I think it's interesting and it can help us sort of tell the story of what's going on. If you've got a unique gene that limits, say, the ability of your liver to process certain medications or to
Mm.
process certain environmental toxins, we know we've got to really have a robust support in place for detoxification pathways. And we
Yeah.
can do that. We know exactly how to do that. But understanding epigenetics also, we don't have to look at the genes for most things. We can simply look at function, the functions that the genes determine. And if the function is off, we can assume there's a genetic issue there. But we also know now that that's real personalized medicine, is when we see the outcome of that gene expression and it's not supporting you in the way that you need to be supported. And that's where we intervene. So it's kind of like indirect
Yeah.
epigenetic practice in real time.
Yeah, what's fascinating to me, I just recently did a test like this, so I'm learning more about my history and things that I need, like you just mentioned, to support
Right.
methylation for me.
Yes. Yes.
And how you can take a bunch of vitamins, but if your body can't absorb them or methylate
That's
properly, they're not going to do much good.
And that's one of the tests that most often do. There's a
Yeah.
handful of things I check, and methylation often. Although I can look at functional tests for methylation, and some people can't afford the genetics, and you know, so there's just different ways to approach epigenetics in a practical way
Yeah.
than just looking at the genetic profile.
Yeah. Tell me about your new book. I know you've written several, but tell me what it's all about and how it came about.
Well, the book is called Unbroken, Reclaim Your Wholeness, and it's really the culmination of my entire life's work, working with people with chronic complex illness and addressing a lot of the things we've already been talking about. And what I want to do for people, and I do this in my work with people, but I thought, I got to just put this, I got to make the syllabus. So it's three parts. The first part is trying to provide the context for why we're sick and suffering, and why we stay sick and suffering, and how much a story it is that's been woven for us, that we've taken into us, that we are body separate from mind and spirit, which is a false story. um, but as soon as we take stories like that into us, we are this disease, we're just
Mm.
like our mothers and our grandmothers, our genes are our destiny, all these stories that come into us, it limits what we can do. It limits our potential. And I think it makes us feel less safe. It
Mhm.
it disconnects us from ourselves. We lose contact with that wisdom and that healing capability we all
Mhm.
possess, but we're disenfranchised from it because of these cultural and institutional stories that we're exposed to. And then I have a whole section on what I call the 21st century science of directable human potential. So epigenetics, neuroplasticity,
Mm,
or functional systems biology, transformational psychology, and how, you know, it's a robust body of science that's all about hope and our
mm,
incredible potential we all have to heal from most everything. Um, and then an entire section just on practical, how do we do this? What's our roadmap? What's our terrain of healing, which is what I call all the aspects of our lives that make us us, that affect our gene expression, that we largely have control over. What are those things? And w- how do we activate that terrain? And I came up with this 9 unbroken core resilience stepping stones, which are
mm.
the things we can do every day in various arenas of our lives to activate that terrain of healing so that we can create a reservoir of resilience that not only can help us solve our immediate problems, how we're sick, how we're
Mm.
suffering, how we're in pain, but also just, take us places we never dreamed we could get, in terms of our energy and our life force and our ability to unleash our potential as humans,
Can
whatever.
you give me a couple of those? Like, I think that's tangible things that people can do today.
Oh, yeah. So,
Here's some of your favorites.
the the stepping stones, and I call them stepping stones because I love that idea of people just choosing what they need when they need
Mhm.
it, and they can just step there and they can work a little bit somewhere, and then when they feel called, they can work in some other domain that that needs their attention. Um, And so the 9 stepping stones, the first one, the one that I think is the most important is called be present. So it's just learning how to be present to yourself, to be
It's
present.
amazing how we have forgotten to do that. We've
We
forgotten
don't
how to be present.
And children know, right? It's like an
Yeah.
innate
Mm,
attribute of humans. Children are very present. They're in their bodies. They're feeling
mm,
their feelings. They're like little, creative geniuses, right? They're in present time.
yeah.
And then we unlearn it. We're
Mhm.
in all kinds of ways, we unlearn it, and then we forget how to do that. But if you're gonna change, grow, heal, you have to be able to know what you need, right? And you have to be able to help keep yourself safe, and you have to be able to evaluate the outcomes of what you do to help yourself heal, and you can't do that if you're not paying attention. And
Yeah.
I think many of our lives are crazy, and there's so many distractions. um, it's hard to be present. So I feel like it needs to be a practice. And, practice makes progress. Little practices, little nuggets of time that you show up for every day. And then, over time, you can expand, and it's extremely powerful.
Yeah. That's a good
Um,
one.
so that's and if people do that one and none of the others, it doesn't matter. But then we get into what I call balance. Um, and that's kind of more about becoming resilient in the face of challenge. And there are a lot of strategies about addressing that. A huge one is rest, which includes sleep and play and pauses. Oh my gosh, it's powerful, right? We don't know how to rest, and rest is scary. Talk about trauma. Rest brings up all kinds of traumatic things
Yeah.
because,
We have to be still in our own mind. Yeah.
and feel.
Mhm.
um, Movement, nourishment, and food. Um, Getting rid of roadblocks. I call it liberate. So it's like getting out the distractions, the negative energy, the environmental toxins that get in. So just getting the roadblocks to healing out of the way. Learning to feel and honor feelings for their wisdom. That's a huge one. Love and live your purpose. So some of
Yeah.
those sound like that doesn't sound very medical, but it's so important. It's so key to who we are, and it's so key to the entire healing process.
Yeah, you say it doesn't sound medical, and yet we go right back to where we started in that you can put tape or a Band-Aid on something or give you medicine, but if you're not dealing with all of those things that you just mentioned, does the medicine really work? Or
Right.
or can you heal
Right.
yourself or get better
That's right.
from these chronic things that we think we have to live with.
And
So much
Band-Aids
good
aren't wrong.
information. Yeah.
Band-Aids aren't wrong. Sometimes
Yeah.
we need a Band-Aid, like, we need to reduce suffering here. But we just have to keep in mind that we're dealing with an issue as far downstream as we can go. So we can
Yeah.
put that Band-Aid on, but if that's all we do and we send somebody on, they're
Uh-huh.
vulnerable. We leave them vulnerable. What have
Yeah.
we accomplished, right?
Yeah. 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 Where can people find you and get the book and all that good stuff?
The book, Unbroken, Reclaim Your Wholeness, will be released on 11/11/25 in audio, ebook, and print versions. My website is the hub, www.karynshanksmd.com, KarynShanksMD.com. And all the practices, meditations, safety practices will be on my website that people can access at any time at no cost. We explore those all deeply in the book. I also occasionally post on Instagram and Facebook. I'm not a huge poster. Um, I'm definitely not a spammer. So feel free to visit me there as well.
Terrific. Well, I appreciate your time today and the way that you approach all of this. Just so important in giving people hope and really helping them heal.
Thank you. Thanks for
Yep.
having me.
Nice to talk to you.
You too.